Hello everyone, welcome back to my channel. I am Soumya Tiwari and in this video we will be discussing about glenohumeral joint. So let's start the video. So first we will be discussing about articulation. It's articulation. So if you see it's a concave part which is your glenoid fossa. This is the glenoid fossa which is articulating with the head of the humerus. This is the head of the humerus. So what will be the articular surfaces? So glenoid fossa and the head of the humerus is the articular surface of glenohumeral joint. So if I am saying what will be the proximal surface, so it is glenoid fossa, and what will be the distal surface in glenohumeral joint is the head of the humerus. So if you see this glenoid fossa has a concave structure. Which structure? Concave structure. And the head of the humerus has a convex structure. So it is very large. It is very large as compared to the glenoid fossa. It is about 4 times larger than the glenoid fossa. So do you say this joint is a congruent joint? So no, it's not a congruent joint. It is incongruent joint. Why I am saying this? Because if you see the head of the humerus is large than the concave surface of your glenoid fossa, so there must be something which is going to make your joint stable. So there is ligament, capsules and labrum, which we will be discussing next. So now next we will be discussing about the anatomical position of the bone. So if you see, the glenoid fossa is oriented laterally, and what will be the position of your head of your humerus? So it is oriented superiorly, medially. This is the medial side. It is oriented superiorly, medially and little bit posteriorly. So this is the anatomical position or orientation of your bones of glenohumeral joint. So now next topic which we will be discussing is your which type of joint is glenohumeral joint. So if you see, the head of the radius is like something like ball like structure, and it is like socket like structure. This is the glenoid fossa. So which type of joint is this? It is a ball and socket type of joint. Which type? Ball and socket type of synovial joint. Now, how many degrees of freedom this joint has? So it has 3 degree of freedom. So now next important topic is your angle of inclination. So what it is? So it is basically an axis of through your head and neck in relation to the longitudinal axis of shaft of humerus. So you can see there is an intersection between these two lines. So it is the angle of inclination. So it is basically about your 130 to 150 degree is the normal angle of inclination. So this is 130 degree to 150 degree is your normal angle of inclination. So now next important topic is your angle of torsion. Same like as angle of inclination, there is another angle in GH joint which is your angle of torsion. So let's see what it is. It is the angle which is formed between the axis of head and neck to the axis through your condyles of your humerus. So let's suppose this is your condyles, this is your transverse axis. So let's suppose this imaginary axis is coming upward like something like here. So there is an angle which is formed between your condyles and head and neck axis. So this is your angle of torsion. So if you remember, I have already told you that the head of the humerus is slightly posterior. So the angle of torsion, it is also termed as retroversion or posterior torsion of humerus. So what will happen if this angle decreases? So there will be anterior version of humerus. If this angle is decreasing, it is your anterior version. So now we will be discussing about your accessory structures of glenohumeral joint, which is making your joint the stable one. So first is your labrum, ligament, and the capsules, which is making your joint the stable one or congruent one. So let's see this one by one. So let's suppose this is your glenoid cavity. You are seeing this from interior side, so it is something like this. So it is not so much concave so that it is making your joint stable. It is a shallow structure. It means it has less concavity. So which structure is making this glenoid fossa more concave? So there is a glenoid labrum which is attaching on your peripheral side. This is here, like, your glenoid labrum is present, which is making your, this is your glenoid cavity, this is your glenoid cavity, and this peripheral portion is your glenoid labrum. What is the function of this labrum? So it is making your glenoid cavity is more concave so that the head of humerus doesn't find any difficulty to articulate it with. So this is its function. And it also what you say, it also reduces the friction between these two articulation surface. Which two articulation surface? Glenoid cavity and the head of humerus. So this glenoid labrum increases the concavity of your glenoid fossa by 50%. This is so much. So now next accessory structure is your capsule. So capsule is a weak, loose in structure. What is capsule? Basically it is a structure which is surround your joints completely, which surround, let's suppose this is a joint, and the structure which is completely closed or packed the joint is your capsule. So shoulder joint capsule is a weak and loose structure. So it is attached medially, laterally, and superiorly. Laterally, medially to the margin of glenoid cavity, laterally up to the margin of anatomical neck of humerus. Anatomical neck of humerus. So this is all about the capsule. So if I am asking you what is the close packed position of your shoulder joint or glenohumeral joint, so when you abduct the arm or rotated abduct the arm or rotated laterally, abduction with lateral rotation, so this time it is your close pack position. Why? Because your capsules are taut in this structure when you abduct or laterally rotated your arm. So this is your close pack position. So if you know which dislocation is more common in shoulder, so your answer will be anterior and inferior dislocation is more common in glenohumeral joint. So why this anterior and inferior dislocation is more common in glenohumeral joint? So basically the capsules in anterior direction or inferior direction is very weak. So just because of the weakening of the capsule, there is a chances of more dislocation in anterior and inferior direction. So now next we will be learning about ligament, the third accessory structure. So this ligament we have divided into two: GH, glenohumeral ligament, and your coracohumeral ligament. So this GH ligament is furthermost divided into three: superior, middle, and inferior. So let's discuss this one by one. So let's try to learn this ligament in this picture. So we have discussed about superior GH ligament. So this ligament is attaching from your glenoid labrum to the upper neck of your humerus. Now second ligament is your middle GH ligament. So it is attaching from your glenoid labrum to the proximal part of your humerus. Now the third ligament is your inferior GH ligament. So this ligament is very special. Why? Because this ligament is furthermost divided into three: anterior, axillary, and posterior part. So this inferior GH ligament is divided into three part, which is known your IGHLC, inferior glenohumeral ligament complex. So now next ligament is your coracohumeral ligament, which is originating from your coracoid process and attaching to your humerus. So this is all about ligament and capsules of glenohumeral joint. So I'm ending this video here, and I'll be back soon with the part 2 of glenohumeral joint. And thanks for watching.